President Obama's healthcare law, of course, now we're expecting the Supreme Court to decide on this Thursday. Here we have images of the 9 justices. And we have Quentin Futrell joining us. Quentin, good morning.
Good morning.
And you say, and you have a good story today on WSJ.com about, well, whatever the Supreme Court decides, healthcare insurance premiums are going up.
It's not going to make a blind bit of difference, effectively. Clearly, if the law goes through and it's deemed constitutional, there's going to be some 30 million people potentially accessing the system. It's going to put strains on the system. It's going to be a lot more financial
pressure.
That's
if the law is upheld.
Right.
Yeah.
But if it's not, you know, all of the people I spoke to said it's going to still go up, including the National Association for Health Underwriters. The fact is that people are living longer. Obesity-related diseases are still on the increase, like diabetes, chronic heart disease. There's dwindling competition within the industry.
With some, there's been consolidation among
So
healthcare insurers.
If your healthcare insurer puts up the rate for you, there's precious little else, you know, places to go.
Tell us about Massachusetts. Now, of course, that was in 2006, I believe it was. They instituted what was considered the forerunner to Obamacare, a model.
Right.
And there's some interesting data in your story about how premiums in Massachusetts have actually gone up faster than the national average. And my question is, does that indicate, I mean, that might be expected with more people accessing health care.
Absolutely.
Insurers would have to adjust them, you know, they're going to have to charge others more to compensate for the fact that you have a lot more people signed up.
Right.
Does that indicate that if the law is upheld, rates would grow faster than they otherwise would nationally?
It would seem to. The rates in Massachusetts after the reform went through went up about 5% more than the rest of the country. So that was a problem. Also, you know, some people say, well, in anticipation of these reforms, insurers are also putting their rates up in advance because they know there's going to be extra pressure on the system. But what Massachusetts did, interestingly, in 2010, it used its own existing legislation that it had, state legislation, to review and in some cases block what they thought were excessive premium rate rises. And the interesting thing about the current Affordable Health Care Act is that there is no key provision to, at a federal level, to prevent insurance companies from putting up their premiums. So some states, including Massachusetts, and when Massachusetts did that, actually, the rates were going up between 15 and 20%. They started going up maybe by 9%. So it really did help temper the increase in premiums in that state.
Is there any hopes that you'll actually get some curtailing of health costs as a result of this law?
Well, you know, it remains to be seen, really. I mean, there are a lot of new provisions, like the preventative, free preventative care, for instance, where you can go in and get a slew of new procedures done for free, in the hope that in the long term it will reduce the overall burden on the health system. So it's really an experiment that has yet to play out, I suppose.